Fortified City TV presents Health Matters. We bring you education and awareness on your health, the total person, your spiritual health, your physical health, and your financial health. Please join us, faith leaders, professionals, and community leaders, this Thursday and every Thursday at 6 p.m. CST or 11 p.m. GMT for a life-changing encounter. Your health matters.
This place right now. Believe it. Believe it. Believe it. Believe it. Hello and welcome again to another edition of Health Matters. Yesterday we started with personal hygiene, and we will continue today with the ending of our personal hygiene, and then the following weeks we have wonderful topics that are lined up. But tonight, I want you to invite someone, and thank you for joining us. This promised to be another interesting conversation concerning your health. Before we continue, I just want to, say just a brief word of prayer. Father, we thank you at this time. We honor and worship you. Your word declare in 3 John 2, Beloved, I wish above all things that thou mayest prosper and be in health, even as the soul prosper. We thank you for healthy people. We thank you for healing and deliverance. We thank you for long life and prosperity. We thank you for causing your people to fulfill their divine destiny. Thank you, Lord, in Jesus' name. Amen.
Amen.
Amen. Tonight, I want to welcome all of you again. This is Health Matters, and it's a presentation by the Fortified City International Ministries, and you are on Fortified City TV. Tonight, I want to welcome again our guest. She was here a couple of weeks ago, but I want to give her the opportunity to, introduce herself. You are welcome, Abby.
Hi, Pastor Patience. Thanks for having me back. For those of you who don't know me, my name is Abby Tyler, Abigail Tyler, formerly. I am a family nurse practitioner, and I'm also a nurse of 22 years, acute care nursing. I practice in family care. I also precepted a lot of new nurses over the years, and I'm also a certified nursing assistant instructor. And I'm also the administrator of Abby Tyler's Healthy Living. That's my blog right there. So I talk about health and wellness and many other topics. So if you're on Facebook and you want to join us, I say welcome. Just send me you can send me a friend request too if you want to be my friend, and also if you want to join my forums. So I'm happy to be here, and I'm happy to be of assistance to my community and culture. But first, I would like to say, I always start with a disclaimer: whatever I say here is not intended to diagnose or treat, or you shouldn't make any decisions or alter any of your regimens based on what we say here. Your family doctor or provider knows your history, your allergies, your family history. So whatever, if you hear anything that we say here, you want to bring it up to your doctor, that's fine. But please do not alter any regimen based on what we say here. Everything here is for informational purposes only.
Thank you so much, Abby. Abby rightly said, always consult your doctor to make a final decision as it concerns your health. We are here to bring information and bring awareness to those things that, we ought to do or you ought to do to keep healthy. Because if you are healthy, you can do a lot of things, and you can achieve those things that you want to achieve. Those plans you have made, when you are healthy, that is the only way you can bring those plans can come to pass. And God wants us, he wants us to be healthy. He wants us to be healthy because it brings glory to him. He wants us to be healthy because it's an evidence of his power that is at work in our lives. He wants us to be healthy because we have to fulfill destiny. God has mapped out a play for every one of us. And if you are healthy, you will be able to fulfill those plans. So he wants you healthy. And so the scripture tells us that we ought to be healthy. There will be times you will be sick, but you need to do everything you can to keep yourself, your environment, your family, everyone connected to you. So tonight we are here and talking about personal hygiene. Personal hygiene. So I want to go back to Abby. Abby, we talked about personal hygiene yesterday, but before we go to our slides, I wanted you to just give us a summary of what personal hygiene is.
Before
And
we
what
start before you start I don't see us live on Facebook yet, and I need to share the video. Did you?
we are live.
Because I didn't get the notice yet that we're live, so I
Oh,
can't share the video because I didn't get the notification yet.
I send it to your messenger. You want to check your messenger?
Let me see that, because
Yeah.
usually if it was that, I would just do it on my sorry audience. I'm just looking here.
Yeah,
All
so
right.
we all here, this is personal hygiene hour. We are talking about personal hygiene. So next week, another interesting topic. I like the name health, health matters, because your health matters. Your spiritual health matters. Your relationship with God, it matters. Your personal health, your physical health, you need to be healthy. It matters. And then your financial health. We're going to be bringing some financial people that will be telling us, what we need to do as a concern our finances. So make it a date with Thursday on health matters, because there are a lot of information that is going to be passed out. So share the video, share the video,
You
share the
sent me
video.
you sent me the older link. That's the link from last week.
Oh my goodness,
That's why I'm
let
not.
me go back. Let me go back.
Yeah.
Okay, just um
Fortified City TV presents Health Matters. We bring you education and awareness on your health, the total person, your spiritual health, your physical health, and your financial health. Please join us, faith leaders, professionals, and community leaders, this Thursday and every Thursday at 6 p.m. CST or 11 p.m. GMT for a life-changing encounter. Your health matters.
Place right now. Believe it. Believe it. Believe it. Believe it.
and we are back with Health Matters. We got it right now. We are sharing the videos, and we want you to do the same, share out there, because there are things we are going to be saying that someone out there need to hear. So invite someone to be part, share the video. Abby,
Yes.
how you doing over there?
Everything okay. Good. We're okay. Good. We're in business now.
Oh, wonderful. And thank you. I didn't really look at, what I was sharing. I was just in a rush. I just wanted to share, get it over with. And then I mistakenly shared the old video. But nevertheless, the new one is out. So health matters. And tonight we are discussing personal hygiene part two. Part two. Abby, you want to tell us briefly what personal hygiene means?
Well, it encompasses a lot of different areas, like the one we talked about earlier. We discussed that I was going to be talking about today. We're going to be talking about healthy sleeping habits, Personal hygiene, meaning for females, what they're supposed to do to keep themselves healthy. For males, also keeping your house clean and germ-free and clutter-free to bring down your anxiety level. I think I talk about sleeping, sleep habits, sleeping 6 to 8 hours a day so you allow your body to rest and recover so you can be fresh to face the day. When you go into sleep, make sure you're not sleeping you're getting enough sleep. You're not watching something really terrible on TV or getting involved in arguments on social media that's going to interrupt your sleep and cause you a lot of anxiety. So there's so many different things that it encompasses. So we'll be talking more about it in detail, specific angles as we go through the show today.
Thank you so much. I'm guilty about the sleep aspect of personal hygiene because I, have, I don't want to go there, but, I have very little sleep and that is not healthy. Please don't be like me because I know there's someone watching this video right now. They will say, Patience, I know you don't sleep for several hours, but it is important because your health counts. Your body need to
Rest.
need to rest. You need that rest. So we back to Adi, personal hygiene. Let me bring out our slides here tonight. And okay.
Okay, ready?
Yeah, correct.
Okay, so first we're going to start with no sharing of personal items. Said do not share personal hygiene tools. So we'll start with towels. That's where most of us in developed world now. So you don't have to worry about sharing towels and everything. But mostly that also goes with when you go to people's houses. You go and wash your hands, and that beautiful towel that's hanging behind there for guests to wipe their hands on. Please do not wipe your hands on there. Please, 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 because everybody else who went into that bathroom has wiped their hands on there, and some people didn't wash their hands the right way. Plus, you just reintroducing the germs right back and severe bacteria right back on your hands. So if it means taking your clothes and wiping your hand inside of clothes, put your clothes inside out and wiping your hands there and do that. And then also have your hand sanitizer with you everywhere. So at least you can just come right inside over. If it's at the person's house, you can just take it, put a little bit there, dab a little bit on. So that will help. But if you put your hands on there, you're getting every bacteria, everything else that's going on in its house. I've also gone to the point of telling people, don't hang any towels behind your blades. Always have paper towels available. Also shaving razors and all for males and females. Do not share it because at the same time, even when you shaving, because usually sometimes after you're done shaving, you feel a little burning there. So that's just like little microscopic areas that open up in your skin, and you could be putting a little bit of blood or whatever you have in your body system. If somebody shares it, whatever you're doing, it could be introduced into their body as well. And so you don't want to do that. You don't want to share razors. And when you go to the to go get your hair cut at the barbershop, the salon, and all that. Usually they have all their different sanitizing cream and the lotion. Make sure you see that when you leave the chair, they're using a new one when it comes to you. It's not the same thing that they just move from one customer to the next customer. Definitely do not share toothbrush. I don't care how much you're in love with the person. And, no, do not share toothbrush. Do not share toothbrush. Do not share toothbrush. Because dental hygiene is very, very important. That's why you should be going to the dentist every 6 months anyways for your biannual dental cleaning. And also they have to make sure you're not developing any kind of diseases that form in the mouth that could cause other problems later on. So if you're sharing somebody's toothbrush and they're sharing the same thing, do not do it. Please do not share toothbrushes. Utensils. When you're eating, you're not supposed to share utensils to people anyway. I see pictures, people go home and then they're like back home and they're eating in the same pan or they're eating in the same bowl and they're,
eating with our hands too.
Yeah, I know that too. You eat because it's like, and people say, oh no, when we were growing up, you ate it, you didn't get sick and all that. But I tell people there were no records taken. So what if you got sick from this? You got sick from that. You got sickly, gravely sick. They just say you were witchcraft. You went to this person's house, you ate something there, and you got sick. That's it. That person put wish in you. So as much as possible, do not share utensils. And also don't share utensils with little kids because whatever you have in your mouth and all that too, when you share it to little kids, that's why most of the herpes simplex majority of the world has it, because the reason most people get it when they're very young. It's like we call it cold sore, and once you get that never goes away. That stays into your system, and whenever you get sick or get stressed out or when the weather changes, you go through that. And some people break out really badly. Some people don't have that much, and some people have to take medications. And also try as much as possible not to share spoon, not to share your utensils with little kids, or even share stuff with anybody else. Makeup especially, eyeliner, lipstick, and all. I know somebody be like, "Oh, give it to me real quick. I can use it real quick." No, no, don't do that. Don't do that. Don't do that. Don't do that. Sometimes it's kind of hard to resist if you're at somebody's house and your makeup's running and you just want to do, even with powder and all that and foundation, still there's still microscopic thing that grows on the skin. So if you do that, your person has a rash and it is not showing clearly, but you get that same thing in your skin, it will affect you even greater than affecting that person. So don't do that. And also eye drops. Do not share your eye drops because your conjunctiva, your eye, red and part, pink part, your eye, those are all your mucous membranes in your nose and your mouth. Those are all the moist, the porous, anything can go in, germs can go in there very easily. So do not share eye drops with anybody. And even when you're doing your own eye drops, try not to let it touch the tip of your eye because you're going to infect the bottle itself. So make sure you're lifting your head up and you put it in. Sometimes it can be a little confusing when you're trying to put it directly there. You can just turn your face to the side, just put it on the outside and just let it go into your eyes and let it slowly there. You can do that with children too. Let them turn their head and just put it there, because my daughter, when she was little, she hated eye drops. So it would be running all over the place trying to get the eye drops in. So you just turn to the side and just put it there and just let it drop, or pull the eyelid all the way down and then drop it in there. So it's easier when you do it that way. So please do not share eye drops. It's very, very important. You could cause you can get to the point where you could become blind from and getting some kind of disease that somebody else had, some kind of infection somebody else had. So protect yourself. Do not put the eye drops bottle tip to your eye, and also do not share eye drops for that very reason.
Thank you, Abby. You struck a very important point when it comes to the towels, because most of the time you visit people, you see towels in the bathroom, and you want to just wipe your hands after washing. So it is very important that we use the paper towel, because you can just trash it right after that use. You can trash it. And I think it is about time that we abolish that tradition that we have towels hanging in the bathroom, that somebody have to come and wipe their hands. Because if you don't have the towels in the bathroom, the next person is not going to use it to wipe their hands.
No.
So, a hint to the wise is sufficient. Yes. Yeah. So let's take note. And you talk about sharing toothbrush. It is not good to share toothbrush, but one thing that we must stress here is the hygiene of the mouth hygiene. We need to be able to see our dentist, like you properly said, because you're not sharing toothbrush, but suppose the person is your spouse and you kissing the person,
Yes. That's one of the main reason when it comes to sexual stuff too and all that, whatever it is you're doing with the mouth, you're still passing germs back and forth. So, and also for dental health, there are many times when you have a lot of plaque and gingivitis and other things that happen in your mouth, your oral health also affects your overall health. So you want the plaques and everything that form could also form in the arteries of your heart. So you want to make sure that if your dentist said come back every 6 months for cleaning, you go ahead and also floss every day. Floss at least twice a day. Even if you can do it twice a day, do it once a day. But make sure you're flossing every day and rinsing your mouth. After you brush your teeth, you rinse your mouth out with mouthwash for at least gargle and everything, and do that at least for like 30 seconds to gargle and wash your mouth with mouthwash, and do that every day to keep in between cleaning and keeping your mouth and your gum clean and safe and healthy, so you don't lose your teeth and all that.
Thank you. That's good. And I know we are listening tonight because it is important. We want to keep our teeth for a very, very long time. We don't want to start wearing danger so early. Yeah.
Because dentures are expensive, and
they are. And you have to maintain it.
Yeah, and the insurance company pays for some, and at the same time, your overall, your mouth and everything, whatever appears on your face, has a lot to do with your self-esteem as well. I know people can say, "Oh, you shouldn't be that's too vain" or whatever. No, it's not vain. It's just basically telling you that when you look good, you feel good, and not pretty, but just presentation says a lot about you. So it's important.
Amen. And now we come to our next personal hygiene topic. We're talking about genital hygiene. You want to draw a light on that.
So we get to other personal hygiene, genital hygiene. I know there's something going on now where most of the stars are saying that they're not bathing. They're bathing once a day. Back in the day, people never had to bathe like more than once a day, but I'd say bathe at least twice, twice daily if you can. If you're not bathing twice daily, try as much as possible to wipe all, like we always say, the pits and privates, and make sure you wash the necessary parts, but at least bathe twice a day. Make sure those who are swimming right now, we're in the summertime. If you go swimming and all, don't, stay in your bathing suit for two, especially for women. Don't stay in a wet bathing suit when you get home. Change it as quickly as possible. Wet underwear, all those different things. Exercise clothing, don't keep it, because when you keep all that moisture when you're exercising, your whole body is all wet and everything else moist. You don't want to keep anything that's going to be moist and everything that's going to be close to your okay, people, I'm talking to the adult crowd, so I'm going to use proper terminology. Okay, so if you don't want anything that's wet or anything moist that's going to be close to the vaginal area, that's going to cause any kind of infection. And also, for women, you have a urethra, which is urine opening where you pee from, and then you have the vagina. So that easily, when the germs crawl up that way, when they go up that way, you can get like severe urinary tract infection and everything. And also you can have some other infection in the vagina area. So you want to make sure that whatever you have on, you want to take it off as quickly as possible. Take a shower or wipe yourself and keep yourself dry in that area. I also said the females, if you have wearing pads and tampons, make sure you changing it according to the manufacturer's recommendation. If they tell you change it every 4 hours, change it, because you're sitting there. I know the new ones now, and they kind of draw the blood away from the body and all, but you also want to make sure that changes. So it's all of that is moist, and you want to make sure you keep that out of your body. You want to change it and keep yourself dry and clean as much as possible. I need to put back to the slide. Can you go back to the slide? I was talking.
Okay.
Okay, sorry. And also,
sorry. Let's go back.
Okay, back some more. We're back on personal, genital hygiene. Okay, all right. And for females,
Hold on. Yeah.
For females, okay, when you're wiping yourself, when you go pee, or you went all the way back again.
Got the slides going back.
Okay, right there. When you go urinate, pee, voiding is a scientific way. When you go there, making sure you're wiping yourself from front to back. You want to take the tissue and wipe from front to back, because you're wiping away from clean to dirty, meaning your urine opening where you pee from, that's the part is sterile. So you want to make sure you're wiping completely from there. If you wipe from back to front, you're taking all that germs again from that area and going back, and so you don't want to get any urinary tract infection. So you want to make sure you're wiping completely from the back. And when you take that tissue, throw it out. Don't go back and forth. Just throw it out. And if you have to use another one, use that. Those who are sexually active, making sure that you're urinating immediately after sex, so you flush everything out. And also, you don't want any of the sperm or whatever, saliva or anything staying around the area to protect yourself, because the urinary tract infection, repeated urinary tract infection, eventually kind of goes up the kidneys and eventually will cause some damage to your kidneys. And also, you don't want to do that. So you want to make sure and drink plenty of water at all times. Drink plenty of water to make sure you're flushing everything out. And if you have to go urinate, whenever you're out and you have to urinate, whenever you have the chance, go urinate. If the minute you feel the urge, everybody train the body, especially for nurses and people who do things where you have to be not going to you don't have enough time to go to the bathroom, but as soon as you can, go to the bathroom and pee out. Because what happens when you hold your urine for too long, all that urine is just sitting there, and it's just piling up germs and bacteria and everything, because it's just there. It should be pouring out for your body, your kidneys and everything to go back and start refreshing everything. So you want to make sure as much as possible, if you have to pee, go ahead and pee. Don't say, oh, I can hold it. I know we've done that many years. I've done that forever. But make sure, try to pee. When you feel the urge, go ahead and pee. Okay.
Very, very important. When you feel the urge, go ahead and pee. You don't want to get sick.
Yeah, and then also, if you're going on a long ride, make sure you pee right before you go, so that way you're not, because I know you go somewhere on a long ride and people start telling you, oh my God, we have to stop again. And some people have like weak bladder. So, and if that's the case, you want to make sure you talk to your doctor about that too, because there are medications that can control the bladder from some like frequent urges and not feeling completely empty after you go. Those are disease process that you want to discuss with your doctor as well.
Okay, I want to ask a question without looking at the manufacturer instructions or recommendations on the pad, the sanitary pad. What is the best, the best time to change? Like, how many times can you change?
It should be no more than 4 hours though. But then you also have to take into account that everybody the menstrual cycle It's
Yeah.
different.
Yeah.
There's some people who have like, and if you find yourself changing your pads every hour or every two, please talk to your doctor, because that is not normal. That means you're bleeding too much. So you want to make sure, because for women, if you're bleeding too much, if you're changing your pads every hour, or you're changing the tampons, usually it can be for like 8 hours, 6 to 8 hours, and you find yourself changing very heavily, and you're going right through, and you having to use like the nighttime pads or 2 pads at a time. You want to make sure you speak to your OBGYN about that, obstetrician gynecologist. So
Yeah.
you want to make sure you bring that up to your family doctor, and also bring that up to your GYN, because that also can be controlled with medications. And also because you will become anemic after a while. That's why some people, when they become so anemic or they're on a period, sometimes they feel so tired, or they suffer from dizziness, or sometimes they faint, because your body cannot take that much blood loss at one time. So it's very important that if you find yourself changing your pads like more than like every hour or so, and for every period, you want to make sure that you talk to your GYN about
The
that.
doctor. Yeah.
Because you will become anemic, and that can have like very severe consequences too, because when your body is losing the blood, it's not returning back to your heart and your lungs, and your body needs that to stay in alignment. So talk to your GYN if that's the case.
Great. You heard Abby, if you bleeding heavily, because there are some heavy bleeder, people that bleed irregularly, they are heavy. Like some, it's just normal for them. But sometimes you go the extra. Sometimes, like she's saying, like an hour or maybe every 2 hours, your pad wet. You need to see the doctor, because there are underlying factors that causes, extra bleeding. So you need to see your doctor. Whatever it's being said on this platform is intended for you to make sure you are healthy, you are well, you are seeing your doctor, you are following all the safety precautions, and you are praying. I believe in prayers, I believe in miracles. But God has also given the doctors and all the healthcare practitioners the wisdom to be able to help. Jesus himself said, if you are sick, you need a physician. He said the sick need a physician. In other words, if you are sick, you need a doctor. And when the doctor have come to the end of the knowledge, then you need God's intervention. So take, all the necessary precautions as it concerns your health. Stay healthy, even at this time. We continue.
But we also with that, with the doctor, when the doctor comes to the end of the knowledge, in
Yes.
addition to when we're taking care of them, I also tell my patients,
Uh-huh.
I'll do what I can, you do what you can, and God will take care of the rest. So we're all in cohesion, working together there. So it's not, people are like, oh yeah, trust God, don't trust the doctors. We're not saying not to trust God. We're just saying, like I said, mind,
Yeah.
body, and spirit is all
Yes.
to work together.
That's why health matters. Is all about your spiritual health. It means your relationship with God. Your physical health, it means the way you take care of your body. And your financial health, it means the way you handle your finances so you can be rich.
Yes.
So this platform is loaded with all that God wants for you. So just keep coming every Thursday and you get the best, because we're bringing on this platform professionals. We are not just talking, for people that have knowledge in the subject matter. So your health matters. And there was something you said, as a concern genital hygiene. I want you to like give a little more light on that. You said urinate immediately after sex. Why is it important that we have to urinate after sex?
Well, unless if you're using, even if you're using a condom, you're still having a lubricant. And if you're not using condom, if you're using other method of contraception, there's, your body fluid, your male partner's body fluid, even if you're in the same sex relationship. I have to say that part because I have to take care of every patient. It's still fluid that's close, that's in that area. So you want to flush when you're urinating, you're flushing everything out, because it's still at the urethra, your urine opening. All of that is covering the urine opening when you're intimate. So you want to make sure you're urinating and you flushing everything out away from the urethra open and wiping yourself clean, because you don't want any kind of moisture that doesn't belong there to stay there, to travel up into the urethra opening, because again, that would lead to a urinary tract infection, and you don't want that. So it's very important that you're urinating immediately after. And if you're not in a monogamous relationship, or if you're not planning to get pregnant, and don't forget sexually transmitted diseases, you should be protecting yourself. The birth
Yeah.
control pills, any other things will not help. You need a barrier that's going to make sure that that sperm does not get into your body. But even that, that's not 100% effective. So you want to make sure that the person that you're being intimate with, that if anything should happen, that you both have discussed that if anything should happen, where to move on from there. So be careful in getting a responsible relationship with responsible people. So if anything should happen,
Mhm.
you can go from there and discuss that.
Very important. Very, very. And we talk about drinking plenty of fluid. Drinking
Yeah.
plenty of fluid.
You want to, yes, always want to make sure you drink plenty of fluids, non-alcoholic and non-sugary, because you want to make sure you're not adding to anything that's going to cause, especially if you're diabetic or having it. But drinking plenty of fluids, meaning for those who don't have congestive heart failure, or don't have chronic kidney diseases or any kind of disease that your doctor tells you that you're supposed to limit the amount of fluid that you take in because
Yeah.
your body cannot pump it out effectively. So I'm not talking about those people who have disease process already. I'm talking about people who don't. Just make sure you drink plenty of fluids, especially this time of the year too, where it's like in our area, it's like 100 degrees
Summer.
right now. So you want to make sure that you're drinking a lot to make sure, and even in the wintertime, you don't want to get dehydrated because a lot of people, they eat, especially with all food, we cook a lot of salt and everything. So when you took all that salt and salty food and you put it in your body and you're not washing it out with the water and not flushing it out, all of that just sets right in and just kind of clog your arteries. So you want to make sure that you're drinking at least 8 ounce bottle, 8 ounce bottle of water every day to make sure that so like 40 ounce. So make sure you do that, and except those who have disease process going on, like I said.
Good. Thank you so much, Abby. We'll continue with our slides, viewers. Sleep.
Okay. Recreation and sleep. I mean, this is what we talk about. I was just like, it's like life is very stressful. So allow yourself ample time to relax. I was like that too. I just finished school like last year, and even with school and with work and everything else that we have going, especially when I'm off, I usually stay awake till like 1 o'clock in the morning because I'm not a morning person. As long as I've been working 7 to 7 p.m. many years, I still, if I have to sleep late in the morning, I'll sleep. So it's important to make sure you go to sleep the same time every night. Even the days that you're off, you don't necessarily have to go to bed. Let's say if you go to bed 10 o'clock every day, and the days you're going to be off, I mean, maybe 12 o'clock would be reasonable, not 3 o'clock in the morning, because then when 2 days later, when you have to go back to work, your body has to recover all of that again. And you want to make sure you're sleeping at least 6 to 8 hours a day, especially if you're an adult. You need time to rest and recover, because all those cells that have been working all day, somebody didn't die overnight, and they have to and some more regenerate. So you give the body enough time to rest. It also brings down your blood pressure, it brings down your heart rate, and enough sleep. Some people wake up and you didn't get enough sleep. You feel so nauseated because the body's like, oh my God, I've been going all day. I need time to rest. That is a very important part of life. Sleep is one of the functional health patterns we learn in nursing school too. It's very important. That's why when people are sick, everybody comes to visit. I'm like, okay, you can visit now, but at least give this person time to rest. People can be visiting all day. They need to rest. Turn off the TV, watch, mindless TV or less stressful TV at night. I usually watch the Golden Girls or something funny, or I just get on, it's just something, that would make me laugh. And if I watch the news to stay informed, but sometimes I'm the kind of person that internalize a lot of things too. So if I see something bad or I see something, and I just take it because I internalize that, and I internalize other people's grief. So I try to make sure that I keep myself a little more healthy and not so much remain detached, but to put yourself in a way where I can sympathize with that person, but not to take it to the point where I'm feeling what they're feeling and cause myself some other then, because everybody has pre-existing conditions already. So you don't want to take on so many more things that you can. And we live in a world now where things happen in some small town in way across the world. It comes to us immediately on Facebook.
Exactly.
So we're like, oh my God, this is going on. This is going on. This is going on. Those things were happening before, but it's just that we weren't worried right away. So we take everything comes to us all at once. So you have to say, wait a second. I have to filter out all the, things that I need to do before, things that I can handle, and other things I can handle little by little, or just, I don't want to deal with that right now. And I'm not being insensitive. I need to be able to take care of me to keep myself healthy. So then no heavy drinking, no, eating and everything before bed. See, because if you're eating healthy, eating heavy before you go to bed, you don't have enough time to burn up that fat. So everything you're eating is just like staying on you and just piling up there in your veins and your arteries and all that. So you want to make sure eat a light snack before going to bed, and just, do the best you can to kind of relax.
This is important, stay informed, but be careful of internalizing all the bad news. And this is what is going on right now. There are a lot of misinformation, a lot of conspiracy theory all around the place, and people really internalize the thing. They see those information as the final word. It's always good to research. It's always good to get information from the right source. If you have to hold on to those information, get it from the right source. So you are sure that you are receiving and internalizing the right information, the accurate information. Because if you don't do it, those kind of information, it allows fear to set in. And when you are fearful and you begin to worry, it brings upon you a lot of illnesses. Your heart,
your heart, your heart and your arteries, your immune system breaks down, because it's like, okay, it's always in a state of alert, and it never has a chance to breathe a little bit, and just every time I'm fighting something. That's not good. And your whole mental psyche and all that's not good. So and people right now, we're in an age where academia is like frowned upon. So if somebody says something, just because you're a doctor, or just because you're NP, just because you're a nurse, doesn't mean you know more than me. Well, if the pilot tells me something, if I'm getting on a plane, the pilot says something, I'd be like, yeah, you know what? Yeah. People think that we just, whatever it is on Google, that's how we get our education. No, I tell people, we went to school, we went and we're responsible. Whatever I say and all that, I'm responsible for it, because I have a malpractice. I have a license to protect, and my malpractice insurance and all that. So I'm not going to come on and just say things like I just picked up from Google. Anybody can put anything on Google or Wikipedia. And there's so many things, so many people have agendas out there and want to put out. So if I'm coming to you is from lived experience as a nurse, as an NP, and also in the fact that, okay, this is what I saw, this is what I dealt with. I have no reason to lie to you. So when people, like, oh yeah, you just saying that because you this, you that. No, this is real life for us. We're going back to wear masks again in Pennsylvania, and I work in Philadelphia, so we have to wear it again in the stores. And most of the companies, they see that. The other companies know that. They're like, okay, yeah, you have to show whether you were vaccinated or you have to wear a mask. All these people are not just being hysterical, say, oh yeah, we're doing this. It's for your own good. It's like protecting everybody, and they don't want to get sued either. You're not coming to somebody's facility and saying, oh, I was there and I got it from you. No way. They'll be like, no, we told you this is what you need to do. Even with employees, they'll be like, no, you don't do it. Fine. Guess what? You can't sue us, and you can say we were responsible. We're not going to pay you unemployment because we told you these are the things you need to do. Nothing's guaranteed, but we're saying this is a layer of protection that you need to do. And if you choose not to do it, then it's on you.
That's right. Absolutely. And last on this slide, we talk about no heavy eating or drinking before bed, because you don't have enough time for the food to digest, right, Abby?
Yes, you don't have enough time for food to digest. That's why it says the saying is you have to eat your breakfast as a king or queen and eat your dinner as a pauper, meaning that you want to eat like your heaviest meal during the daytime. So your breakfast, eat a really heavy breakfast. I mean, if you're going to work, don't eat very heavy because you're going to be sleepy. But eat most of your meals and in lunchtime, eat a heavy lunch and all that, and eat like a light dinner. Or, even if you eat dinner around 5 to 6 o'clock, and that may be a little difficult for people who have different job hours and all, but eat like a nice size dinner. And then go on and eat healthy. If you stay awake till like maybe 11 or 12 o'clock, eat a healthy snack, like a fruit or something, or one of those nutrition bars and stuff like that. A cereal. Sometimes I eat cereal before I go to bed. That at least and it's not sugary cereals like Cheerios or something like that, or whole grains. And I myself, I know people saying, oh yeah, these health people, they know how to be healthy, or that healthy other person, and she says she's this and she's not, or she's this and she's not that healthy. I'm like, we all fight it too. We're humans just like you. It's not like to say because we know all these things, so we do everything 100%. I tell people, if you put a salad in front of me and you put ice cream in front of me, I'm gonna go for the ice cream first. So definitely I'll eat the salad first, and then I know I'll eat the salad real quick, knowing that I have to go for the ice cream later. So that's how I train myself. I kind of treat myself every time. I'm like, I'm going to eat this, and then I know I have to eat something else to kind of counteract that. Get
Yeah.
that to come out of the body.
And then we come to our food hygiene. You know, we eat all kind of stuff, eat a lot of fats, a lot of salt, a lot of oil, and large portions. Not small portion, but large. Not sizable one.
I know. Yes, it's like when I think about it, like we used to eat like in these big bowls back home, and even here, one of my uncles used to eat like he like this really big bowl. You'd be like, wow. And he's like, oh yeah, I worked so hard today and I eat it. And back then, the food's good, and over here too, the food's good, so you want to eat in big bowl. But it's like I want to eat like one spoonful of rice now, and I'm trying to cut back on my rice intake. And so it's like eating brown rice or sometimes you mix the rice, brown rice and white rice and mix it together until you get to the point where you can tolerate the brown rice, and some people would never will. And some people are like, oh no, I like my food. So portion control, and like I said, we eat a lot of rice, we eat a lot of white bread. So you want to and this on Google, you can go in there. Sometimes we health store, it's called Dash Diet, is dietary approach to stopping hypertension. So it's DASH diet. So it tells you have to eat low fat. And like I tell people, Liberian people don't eat most of the mashed potatoes and everything else that it goes. So I'm trying to make it culturally relevant. If you're going to be cooking cassava leaf, you could be cooking palm potatoes, different thing. You don't have to put everything in a pot. Not every meat in the zoo doesn't have to be in a pot. I mean, because we eat bone, we eat fish, and we eat chicken, and we eat crab, and we eat all of that is in one, and that's a sign of wealth. Because when you were, back home, you had a little bit, any little bit that you had in food was like, oh my God, you're struggling. So now we're at a place where we can afford to eat really well. We put everything there. I mean, some people had it back home too. You put everyone up, but it's like, it's still, when you get healthy, when you get more money, then you also put yourself in a position where you become unhealthy because you can afford to buy so many things and eat so many things at once. So you make sure you put in more seafood, eat more like dried chicken, because you're taking away all the fat, eat more boning and things like that. All those things is really, they're really good in replace if you have to eat one main thing, you can put one main unhealthy, you know, pig feet, don't put too much of that there. More fish, like I said, more seafood and all. If you have gout or other issues like that, also the purine from there. So I'm not talking about those with disease process, but just do that, and small portions of rice. And like I said, if you go somewhere and you're eating like a nice big bowl of fufu and soup and everything, don't follow up with a whole big bowl of rice. Follow something or just take a small little bit, and then if you're gonna eat small little fufu, that's what
Abby, back home, whenever people eat fufu or something like that, they have to follow it up with a big bowl of rice.
That's because if I feel like I didn't eat anything if I just have food and soup, and then it's like so make the food, if that's going to be the appetizer. If that's going to be the appetizer, then make sure that the fufu is very small. And then the soup and all that, then you can have some rice and all that too. So you take a little bit of that, because fufu is not an appetizer, really. Although it's like when you finish swallowing it doesn't feel like you really, because you didn't chew the rice. So just go ahead and just take a little bit, and then you can have some rice after that, and then make sure you're eating something healthy. Put some healthy things on there, fruits and all. Put it there, so that way when you're done eating, you ate some that's not so good and not so bad. And let me say this also to people who always used to say that, talk bad about Liberian food and this and that. We say this to everybody who eat food that have even with American people, mashed potatoes. Those who and Hispanic people who eat a lot of rice too. Asian people eat a lot of rice. It's not just African people and just not a lot of Liberian people. So anybody who eat food that's heavily based in cholesterol and all that and starch, we tell them, especially because when you start getting into disease process like high cholesterol and diabetes, you want to make sure that you start cutting back on that. So because the more your numbers go up, the more medications you have to take. So and then you start getting complications. So it's very important that you do the most natural way to take care of yourself, so you don't have to take all these medications. And medications not be all and end all. You can still get sicker on it. So you want to make sure that you don't do that.
It also has side effects.
It has side effects, but at the same time, the complications are worse from the disease is worse than the side effects. So I tell people that, you can say, yeah, my medication for my diabetes, it may make me a little tired, but how's that blindness? How's that amputation? Think about it. How's, your heart disease, your heart attack. So let's think back. What is more important? Reverse the priority and keeping ourselves healthy, so we don't have to get to that point. So
exactly, we need to be healthy. So eating a little bit, a portion of whatever is really, really important. And coming back to home, Liberia, it's kind of difficult, not only Liberia, but in other African countries, you find out that, when you get a bowl of rice, that's all you have. So it kind of difficult. And so that's why I can see right now, we see a lot of diabetes and high blood pressure in our community because of
Yes.
our
And,
food, the kind of food we
yeah.
eat. But we're
And
going
back
to come
home,
to that.
yeah.
Yeah,
And
we're
back
going
home,
to come to that.
we did do a lot of walking too back home. We did a lot of walking, a lot of physical activity back home. It's like you went to catch the bus or you went to do this. But
Yeah.
you notice that some of the people who were rich back home, they had a car, they would drive like across the
Mhm.
street. We literally had a neighbor that had a shop across the street from us. They got in a car and drove across the street. So it was like, whoa, okay. So once you start developing health and all that wealth, then you start acting like that, but you're not doing everything else that's supposed to keep you healthy. That's where the
Mm.
danger. And so even though we're eating one bowl of rice back home, but we're busy eating plum and great food and everything and running around playing with our friends, and our mothers used to walk their friends backward. I'll walk you home, I'll walk you back home, I'll walk you back home. They did that like, a whole hour back and forth. So they were really working off everything they just ate too. So that's very important. Your active lifestyle is very important in the grand scheme of things. Very, very important.
And then we talk about keeping our food the way we preserve it.
Yes, and that main thing when I'm at that party is mainly also for the fact that when we go to parties, like if you go to a party and you see the potato salad and it's not
Yeah.
on ice, do not eat it. If you see something that like check rice and how jollof rice is very quick to spoil if it's not preserved, if it's not on burners and all. So make sure you're keeping foods that's supposed to be warm, and keeping foods that's supposed to be cold. And if you're at home too, you want to make sure if you cook and something like you prepare food for the rest of the family, make sure you preserve it in the right way because you can get a bacteria, and next thing you know, it could lead to like some serious health issues. Serious health issues. I mean, you can destroy your stomach lining, and some people have like food poisoning that landed in the ICU and even death. So you want to make sure that you're doing things because when you don't keep it where it's supposed to be, the bacteria, they're so opportunistic too. They'd be like, oh, okay, I see something. This is where I need to be. I love this. This is where I want to be. I'm supposed to be in the warm jollof rice, and the jollof rice is just sitting there and nobody's paying attention to it. That's where I'm going to be. And you remember now, everybody else is touching the spoon to, if you're doing serving stuff. Even if somebody's serving, some people touch the plate to give you food. So you're
Yeah.
passing
And
back and forth, and
sometimes,
people didn't wash
and
their hands and
sometimes
all that.
people that are even serving, they talk too much over the
Yes,
food.
right over the food and all that. So you want to make sure that they're doing everything because, and then if God forbid, if they didn't wash their hands the right way and they had something, a fecal material that can make you contaminate your body, you have hepatitis A, you could die from hepatitis A. So you want to make sure that you watching what you're doing. And if you're going to eat somewhere, people are serving you food, always have your hand sanitizer. But that should be like a fashion thing now. Everybody should have a little hand sanitizer. And if somebody say, oh my God, you're acting so this and you're acting so bougie and you're acting so queer, you're acting so this, whatever, your health matters. So thank you
Exactly.
so
Your
much.
health matters.
Yeah. So I'll be like, thank you.
Someone,
Yeah.
yeah. Before we go to our slides, there's something a lady said here. Um, she said Liberians like to dry the soup to the oil so they can have more oil. He said most greener vegetables are overcooked and
Yeah.
and high in sodium, which is true. We cook our food to the place where we don't have any nutrients in
You
the
take
food
out
anymore.
you take it- and but the thing about it is that's the whole thing about Liberian food, because if you don't cook it all the way, then it's not done. It's not like other people who can just steam the vegetable, like steam the collard greens, steam the spinach, and you eat that, and most of the natural nutrients are still in there. Our food, if you don't cook it and process it all the way, is not done. That's the
Mm,
unfortunate part of the way how we cook our food. So
yeah,
you have to add anything there, a little bit of salt, like and Mrs. Dash and stuff like that, because the salt is salt and seasoning. But we know what we used to do too. We'll put the salt there because I remember we learn how to season chicken or season whatever. You put the salt there, then you put the Maggie cube there, then you put the seasoned salt. I mean, it was like tripling, and money just walking right to
everything.
the
Yeah,
catheterization.
because yes.
Everything that's why we thought, if it, oh, this doesn't taste so good. So to what taste, our taste buds became used to that. So if you eat
Mhm.
anything that's not like that, it's like, oh, this doesn't
She
taste
don't
good.
know how to cook.
Yeah,
Yeah, she don't know how to
so
cook.
your body
Imagine if
gets
it
used
was
to
so
that. So whatever
tasteless
was,
today.
yeah, what was good to us, what was nicely seasoned. Even like I said, with Hispanic, I told my Hispanic patient, and he was like, "Oh no, we got to put some seasoning on stuff. You can just no." So I said, "Okay, well, if you're gonna eat that, then make sure you putting some, eat the salad on the side, put some healthy things around there because that's the kind of food you're used to. Try some other healthy habits and also exercise. So you're not saying don't eat Liberian food, but find a way to make it healthy and add some other healthy things to it. So that way you don't feel like you're eating it. And I taste some Liberian food. You can literally taste the salt on your tongue. That's too much. But that's how some people are used
That's
to it.
how,
And eventually, yeah.
yeah, that's the culture of our cuisine.
Yes.
So,
So
but we want to stay safe. Someone here said health is wealth. And it's true, health is wealth.
yes.
Elizabeth said health is wealth. And
Yes.
Mariah also said health is our greatest wealth. These
Yes.
statements, they are all true. And we
Yes.
need to take care of ourselves. Let's
You
go
don't have
back
if
to
if you're not
slide.
healthy, that's not. And I also say healthy is the new sexy. It's about keeping yourself healthy and all that. And then if you're sexy and it look good and all, I'd be like, hey, because you're healthy on the outside and healthy on the
Mhm.
inside.
Yeah,
So for the home hygiene here, say keep your home clean and clutter free, because when you go to your and don't prevent it prevent roaches. I didn't want to put it down there. Prevent roaches and other critters from they're looking for food. Because if you keep things, if usually you're growing up, it's like you couldn't leave the kitchen dirty at night. Oh my God, you had to wash the dishes
wash the
and wipe it
dishes before you
down
go to
and
bed.
everything and clean the surfaces down, because you want to make sure that you don't invite in roaches and anything else that's looking for food that's going to come in there. Some of those things kind of hang around and crawl over other foods, and also you want to make sure, and
Exactly.
especially if you have elderly people at home, you want to make sure that
Cluster
the
free.
rugs and things like that, you don't want them falling over, because as you get older and you start taking some medications, that kind of affects your ability to stand still, or your depth perception and everything, because the medication, it dries up. The medication taken for blood pressure, other medications kind of dries out their secretions, and all of that make them more thirsty to want to get up and go for something, or get up and they're thinking they can get up real quickly. So you have rugs on the floor or anything that could cause them to fall. That's very
Yeah.
important, that you want to make sure you keep all those things out of the way. And for babies, you want to make sure that you don't have plugs and everything over the place. You want to keep the place clean the surface, especially now that we have all the bacteria and the viruses going around. Have your antibacterial wipes and wiping down the surfaces very frequently, especially when you have people over. Go into the bathroom, wipe it down, wipe the doorknobs and everything. Don't just not just like you want to wipe, especially the doorknobs, because everybody's touching it. So people forget about that. So you want to wipe that down, wipe the doors. And any door that people have to touch to go out like that, you want to make sure you're wiping that down. And if you go in out and you see a lot of handprints there, open the door with the back of your hand, so you're not touching your fingers, your flat hands, not touching it, because chances are more than likely you're going to be touching your face before you clean it up. So if you come to my house right now, I have my antibacterial wipes, I have my hand sanitizers, everything at my front door. So when you come inside and I have my hand sanitizer right there, you just wipe it, you just swipe right away. I have it at my front door and I have it at my back door. So if people are outside, they do that. And I make sure I have everything there. So I have my paper towels. I don't put no towels. I do pretty decorative towels that we talked about before. I don't put it up. Nope. You have to make sure paper towels right there. And please put bags in your trash cans in the bathroom. Please don't just let people be putting stuff right in the trash can. And because when you empty, you can touch it. So I have the plastic bag. When we go shopping, I keep all those plastic bags and I put it in the trash can. And when people use the bathroom, whatever is in there, we just tie it up and get rid of it. Okay,
That's
so
right.
that way you're keeping everything clean and keeping your bathroom clean and keeping your house clean. And make sure when people come into your house, you say, I expect you to please, put your hand, that's your hand sanitizer, and making sure that they be safe around you, because you don't want anybody getting sick from coming to your house.
Mhm. It's important. Clean surfaces frequently, especially the time we are in, coronavirus and everything. Let's keep ourselves safe and keep our families safe.
Yes.
And there's increase in there increase in the cases of coronavirus here and there. So you want to be safe. If you have not gotten your vaccine, you need to go and take your vaccine. At least it's better, to have some preventive measure, than to be vulnerable, 100% vulnerable.
Yes,
So
and get vaccine, wear your mask. There's some people who cannot get the vaccine. They already speak to your doctor about it for other medical reasons and all. But if you can get it, excuse me, go ahead and get it. And I know people still having issues about this, and we're trying to chip you, we're trying to find, mark you, to market the beast, and this and that. I'm like, okay, trying to track you down. I'm like, you have your phone, they can track you down anywhere. The government can track you down anywhere. You have a phone, you have a social security number, you have
I
your
know,
address.
right?
They can find you wherever you are in this world. The government can find you. So I don't know what makes you think that, oh yeah, and it's like, oh, I don't want to be part of any research. Well, guess what? If you don't get the vaccine, you are part of the research, because when they started the vaccine in late December to now, all those who didn't get the vaccine, you were in that control group. Okay, so it's like, okay, so let's see all the people who are getting sick now, the ones who didn't get vaccinated before. Now, I'm not here to say to force anything down anybody's throat. I just give you the facts as they are, and you can go ahead. And people always say, I got to do my own research. No, you're not doing your own research, because you're just reading and you're just reading articles that are favorable to you. You're not reading peer review articles. And that's
Yeah.
different. That's what makes it different from you just read an article that somebody wrote, and those of us who are experts in the area, who went to school and are responsible financially if we say something stupid online, not just people who just say stuff and have no degree behind them and just say it and you just believe it. So, but that, people will believe what they want to believe. So you just give them the facts and just leave it at is.
That's
Sadly,
right.
sadly, those who not getting it, you're making it harder for everybody, because if everybody just did what they were supposed to do, and we won't be like, wearing masks again, going back in their houses and try. Who knows what's
So
going to happen?
true.
Who knows what's going to
So
happen this
true.
fall? So I say,
Yeah.
everybody had their birthday, and now every time when it's time for my birthday, nothing. I can't plan anything because it's going to be COVID again. So hopefully people, I see the numbers going up that people are taking the vaccine. So hopefully we can, knock on wood, we can, try to avert another disaster this time around.
Lastly, our time is almost up. We got 4 minutes to go. We want to talk briefly about giving up bad habits. We got some bad habits that is detrimental to our health. We need to give them up. Abby?
If you smoke, quit smoking. This number 1-800 quit now. If you smoke, no vaping. People think that you vape and it's not. These young kids are doing that. That's just as dangerous on your lungs. Cut back on your drinking. Make sure you're compliant with your medication, and you go to your doctor's office. Make sure you're please following up. When they tell you please follow up the test results, make sure you're following, because there's a reason why they're telling you that. I know it's scary sometimes when we tell you something that you be like, oh, if I don't know it, then it won't bother me. But no, it's because whatever is there is growing, so. And sometimes it's nothing. They just want to just check one more time to see, especially people who get that mammograms and they be like, I need you to come back for another film. I need you to come back for this. And you get scared. You don't want to go. I've been scared too, but you want to make sure that you go, and whatever is there is they can detect it and make sure you start getting cure or getting treated early. And most important thing, guard your spirit against other people's behavior. I mean,
Yeah.
there are times when I look back on the Facebook and many people I wasted time with, communicating with and getting angry with. And I used to be on those Liberian forums and people cussing me out, cussing down my mother, cussing down my family, and back and forth. And I was dishing it out too. I was never one of those people cussing, but I was dishing it out and I stood my ground. But then I look back and I say, you know what? And even now when I want to, like, when people want to go back and forth with me arguing, sometimes I just click okay. And they be like, and if I say, if you think you want an argument, fine. I'm good with that.
Yeah.
Yeah. So it's like somebody was like, oh my God, I thought you were strong and you just weak. All this. I was like, if you want to believe that, then go ahead and believe that. I know I can get rid of you just by clicking off my phone. Why would I want to sit here and be arguing with you and then worry about it later on when I get off the
Right.
phone? So guard your spirit against people who, especially those who are deliberately trying to get at you.
Yeah.
Guard your
Bitter
spirit.
people, angry people,
Yes.
those
Yes.
people, they need help.
Yes.
Thank you so much, Abby, for being part of this program as always. And our viewers out there, we will be here again next week, Wednesday, with Health Matters. Your health matters. So you need to take care of your health. If you want long life, you need to take care of your health. Whatever your dreams are, you need to take care of your health. So God bless you. And I pray for those that are sick at this time. I pray that the Lord revive you. The word of God tells us that he will restore unto you the years the locust has eaten. The word of God declared that by his stripes you are healed. Wherever you are, whatever the ailment, the Lord is able to do exceedingly abundantly above all you can ever ask or think. And I declare healing to your spirit, your soul, your body in the name of Jesus. I declare healing to your family. I declare healing in your home, healing in your marriages. I declare healing round about everything that concerns you in the name of Jesus. God bless you, and we will be here again on Health Matters next Thursday. This has been a presentation by the Fortified City International Ministries, and I'm your humble servant, Pastor Patience, on Fortified City TV. Our guest today was Ms. Abby Tyler. She also have a blog called Healthy Living, right?
Abby Tyler's Healthy Living.
Yes, right behind her. Check her out on Facebook, and there are a lot of goodies over there. So God bless you. Until we meet next week, stay safe. Stay safe. Take your vaccine. Follow all the safety precautions. God bless you.
Good night.
Fortified City TV presents Health Matters. We bring you education and awareness on your health, the total person, your spiritual health, your physical health, and your financial health. Please join us, faith leaders, professionals, and community leaders, this Thursday and every Thursday at 6 p.m. CST or 11 p.m. GMT for a life-changing encounter. Your health matters.
Place right now.